Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome back to my YouTube channel. I am Dr. Dada, and today we are going to continue with the most common G.I.T presentations, which is kind of the last one, and it's going to be the abdominal pain. So let's see. Abdominal pain, which is discomfort in the abdomen. Okay, now what are the types of this abdominal pain? Abdominal pain. Okay, now this abdominal pain is has types, or it's divided into 4 kinds of pains. Types, we have, like I said, there are 4. The first one is what? The visceral type, and we have the parietal type, we have the psychogenic type, and we have the referral type. Yes, so these are the type of abdominal pain. There is visceral pain, parietal pain, psychogenic pain, and referral abdominal pain. Now, what is the classification? It's also classified into what? Into 2. We have the acute abdominal pain and the chronic or recurrent abdominal pain. Okay, now let's talk briefly, very brief, about the acute and chronic. Now, the acute abdomen. This is what the most common cause of emergencies in the surgical ward, which is 50% of emergencies. 50% of emergencies in surgical ward. And the most common causes of this acute abdomen are, or let's say due to, or causes, or appropriate causes, usually due to inflammation, perforation, and obstruction. So these are the most common causes of acute abdomen: inflammation, perforation, and then obstruction. So this is the brief about acute abdomen. Now, what is the chronic or recurrent abdomen? The chronic or recurrent. Now, this one has different kind of causes. It happens due to things like, or it can be due to, let's say, retroperitoneal. It can be retroperitoneal causes, e.g., like what? Malignancy, and it can also be psychogenic, which is, e.g., what? Depression. It can also be metabolic or endocrine cause. As in the case of DM. And it can also be drugs Like what? Alcohol. Alcohol. It can also be hematological, that is blood. Hematological has to do with blood, which is things like what? Sickle cell anemia. And it can be also neurological, as in the case of spinal cord disease. And it can also be what? Locomotor, as in the case of abdominal muscle strain. Now, these are the causes of the chronic recurrent abdominal pain. And in brief, okay, now what are the investigation of abdominal pain? As usual, a very good history and examination. Then tests according to findings or differentials. Your differential diagnosis, DDX. Okay. And the management according to type and cause of abdominal pain. And this brings us to the end of today's lecture. Thank you. Oh, why is this too dark? Thank you. Kindly like, share, subscribe, and turn on your notification button. Gling. Okay, I am Dr. Happy baby.